With the start of the baseball season, I wanted to talk about an injury I see all the time at my office here, unfortunately, and that is Little League elbow. Hi, I'm Dr. Danny Lehnert. I'm a physical therapist, strength coach, and baseball coach at Eclipse Wellness here in Sterling, Virginia. And I want to talk about Little League elbow, what it is, what the symptoms are, and some exercises that we can help rehab it from. So what is Little League elbow? So Little League elbow is referring to pain on the inside of your elbow here. It is often confused with Tommy John injury or UCL sprain, which is the ligament involved with Tommy John. Now it's important to understand that as we're growing, we have what are called growth plates at the end of our bones. So you have, especially the long bones in your arm, the end of it is growth plates, which is a soft cartilage that allows the bone to keep growing. That's why it's soft. Eventually those close when you're done growing, which for boys is when puberty ends, typically, 15, 16 years old, or even later, depending on how slow you are of getting to puberty and how long your growth spurt lasts. So while we're in our growth spurt, we have those soft ends of our bones, and those can become injured. So the areas of the bones in here from repetitive throwing can be injured, and that's what causes Little League elbow. It's the same thing with Little League shoulder, which we'll talk about in a different video at some point. What happens is you get inflammation and irritation in that area. Now, the reason for that is the growth plate is the weakest point of the elbow. It's not the UCL. When you're older, when you're in your 20s, even in high school, UCL injuries are much more common because that's the ligament that's taking all the stress when you're throwing. UCL injuries are a lot rarer in younger athletes because that growth plate will typically get injured first, and that'll be the thing that'll be irritated first before the UCL. So symptoms of a growth plate injury would be initially just pain with throwing on the inside of the elbow. Gradually that pain gets worse. You start to have pain after throwing, and then you start to have pain with day-to-day activities. You might notice some swelling, you might notice some heat in the area, but it'll start hurting with trying to open a jar, open a door, things like that. That's when the injury is getting worse. Now, typical treatment involves a shutdown from throwing. Now, I'm not someone who likes shutting athletes down, but when it comes to cases of Little League elbow or shoulder, it is necessary to allow the growth plate to heal because you don't want, in severe cases, you can fracture the growth plate, which can cause issues. That's very rare, but it can happen if you do keep throwing through pain, which can cause difficulties with actually growing and your bone development and everything like that that can have long-lasting impact. So a 6-week shutdown can often be necessary. During that time, of course, you want to be focused on strengthening. We'll go over some exercises that you can do. And then after that 6 weeks or however long, usually they'll do x-rays to determine how your growth plate is looking. After you're cleared, you begin a throwing program, begin some more plyometric ballistic exercises where you're throwing and gradually progressing and getting back to throwing. Now, part of the rehab can be soft tissue around the area because there can be tightness. It can be strengthening the surrounding muscles, working on mobility, working on throwing mechanics and form, working on workload. There can be a lot of different things that lead to Little League elbow, and it's important to tease out the possible causes when you're addressing it. So now I want to talk about some exercises that I love for my athletes who are dealing with Little League elbow, starting with the simple ones beginning in the rehab process and talking through them, and eventually transition to more complicated ones that are more beneficial at the end of the process right before or in conjunction with throwing. The first thing I want to talk about in regards to healing from a Little League elbow type situation where you have swelling, inflammation, and particularly if you're shut down from throwing, is addressing the soft tissue mobility around that area. Now, using a lacrosse ball, stretching, massage, all that stuff can be beneficial. I love a Mark Pro when it comes to tissue recovery related specifically to baseball players. It's a great thing to use after throwing. It's also a great thing to use as part of your recovery. So what we mistake a lot of the time with throwing, with any sort of activity, is the need to ice afterwards. Now, ice is kind of an archaic concept because what we want to think about is when we have swelling and irritation in the area, the swelling and inflammation is actually your body's healing response. There's a reason that swelling happens, whether it be your elbow, your ankle, anything in between. Your body is sending chemicals that are helping with healing and repairing the tissue. So the issue is not stopping the swelling, which is what ice purports to do. The issue is when the swelling gets stuck in there and doesn't go anywhere. So think about the trash piling up. Trash is good because it's things that you used, you needed them, but then you need to get rid of the trash so you have more room to put trash out. So the Mark Pro, what it does is it connects to muscles in the area and provides a passive stimulus where it's contracting the muscle hundreds of times. What that's doing is creating a pumping effect. So it's decreasing the swelling and inflammation without you having to actively use the muscles and irritate the tissue. So it's a great one to use early in the rehab process and honestly throughout the rehab process. of the forearm muscles, the biceps, getting everything pumping in here so that the swelling inflammation goes away, so there's room for new inflammation to come in, new healing chemicals, things like that, to speed up your healing process. I love the Mark Pro for all types of injuries. I'm not someone who gives good reviews to products a lot. I don't believe in a lot of products. I think that hands-on and good exercise are the best things. If you're interested, I do have a code for the Mark Pro. Shoot me a message and I can give that to you if you're interested in getting one. Or come by our clinic and you're welcome to try it out. It's part of any sort of rehab program that I use with a lot of my athletes. It's definitely worth it in my opinion. There are very few things I'd give that recommendation to. So that's what I would start with when it comes to muscle recovery when we're dealing with the little league elbow. I want to talk about two strategies that I use exercise-wise in the beginning of the rehab process. So first, when we're talking about the muscles that directly attach into that area where the growth plate is irritated, we want to use isometrics. So I love a simple ball squeeze. So using a lacrosse ball, tennis ball, anything like that, just grabbing in here and practicing squeeze to stimulate these forearm muscles. Hold for about 10 seconds and relax. You can do 10 of those for 10 seconds, a couple times a day. You can hold it more like a baseball and kind of squeeze like that. You can play around with different things. Just getting some isometric contractions because that's stimulating the muscle without creating a bunch of wear and tear in the area. And it's also helping with that inflammation decrease by getting that muscle pump like we've talked about. Now, the important thing too to understand is that we want to keep everything else moving as much as we can. We might not be throwing or we might not be loading the elbow directly, but we want to make sure our shoulders stay strong. We want to make sure we keep our mobility, everything like that. So J-bands are great for that. So J-bands are good because they have cuffs on the end here. So you can just slide your wrist in and all of a sudden I'm not having to squeeze like I would a traditional band, which may be putting more stress than I can handle on my elbow, on those tissues in that area. So I can be out here and strengthening my shoulder, doing different movements without putting pressure on that area that's bothering me. So I can work on that scapular mobility, that shoulder mobility. So it's a good thing to use early in the rehab process just to make sure we're maintaining mobility and some strength in the surrounding areas so everything doesn't become weak during maybe those 6 weeks when we're not throwing. Once we're cleared for doing a little more aggressive activity, we can move past isometrics. We want to start loading the muscles that are around the elbow. So the biceps are an important muscle that we often neglect. We do a lot of forearm exercises, a lot of shoulder exercises. Often we skip the biceps, especially in younger athletes. So what I like to introduce early are some bicep curls. I want to make sure we're going through a full range of motion. So we're starting from all the way down here straight, trying to stretch that elbow and just slowly coming up through here, and then slowly and controlled coming all the way down. So that's putting good stress on the bicep to prepare for throwing when we're coming through like this and we need to slow down as we're pitching or throwing so we don't just snap that elbow. We want to work on especially slow eccentric or descent with the biceps as we're coming down through here to start loading that tissue and getting ready for throwing. Another exercise I love to include for athletes dealing with a little league elbow type injury or young throwing athletes in general is a lat pull down. So a lot of people don't have access to a lat pull down bar. You can just use a band for that. So you can loop a band over something, you can loop it over the door. You just want something with a little bit of resistance that really tests you. And so what you want to think about is going up here as high as you can with it. So grabbing on up here. So it's giving you a good shoulder stretch. And then thinking about pulling down as far as you can, like you're bringing your elbow down to your hip pocket, and then slowly coming up from there. So what we want to work on is working on shoulder mobility as we're coming all the way up, getting overhead, and then pulling all the way down when you do it. So you can play around with getting a little bit closer, working even more overhead mobility, and pulling back here, going a little bit lighter, and being able to pull a little bit further and really squeezing. But the lats are important muscles when it comes to getting that mobility back, but they're also important when we come through and throw. Having good, strong lats can help prevent some tension on the elbow. So we want to make sure we include that in any sort of rehab program and general lifting program for young baseball players. Another exercise that I love that kind of integrates the whole arm is a single arm row. So when we talk about an elbow injury, we need to realize that it's not just an elbow injury. It's often a mechanical issue, or it's often a total body injury where the elbow is taking more stress than it should because something else isn't as strong as it needs to be. So single arm row is a great way to address a lot of those issues in the shoulder and also with grip strength. So we're going to be here, one hand, one knee on the bench. Other hands down here, we're thinking about relaxing the shoulder blade all the way down. We're going to think about pulling up by starting with the shoulder blade squeeze and then bending our elbow, bring it to our chest nice and slow, rotating up a little bit, and then coming down nice and slow like that. So as we're doing this, we're really making sure the shoulder blade is driving the movement, because that's replicating if I'm throwing a baseball. My shoulder blade is stopping me from coming forward and gradually recoiling and using all these big muscles here rather than relying on the muscles of the elbow to stop us from just snapping our elbow forward. So looking at some global strengthening like that is important after an injury, just to make sure we're not missing anything, especially with younger athletes. Some exercises I like to include right before return to throw would be medicine ball throws. Now, this is a great way to start moving quickly without putting stress on your arm and specifically your elbow. So starting with a simple side toss here, where I'm coming through like that, my elbow's not having to do nearly as much work as a throw. As we start being able to load the upper body, we can do more of a shot put throw, like that. We can go a little bit overhand, like that. There's a bunch of different things we can do with a medicine ball. So it's a great way to start training your body to rotate quickly before you go out there and throw for the first time. Another great thing to do if you're able to is to swing a bat. Similar kind of thing of just rotating quickly. Now, I also like to include it when we first start a throwing program, because a lot of athletes, paradoxically, who have had an elbow injury will be so focused on their elbow, you'll watch them start to throw and it becomes all elbow because they want to see how it feels. They want to throw focusing on the elbow and they stop rotating everything else. What I like to do immediately before those athletes throw, let's do some medicine ball throws as hard as you can, and then translating that into baseball. Because as we've talked about, if you have an elbow injury, it's probably because you're not rotating in other places, you're not strong in your shoulder, your core isn't being used correctly. So we want to go as fast as we can with some medicine ball throws and then get right into throwing so that they're using their body to throw and they're not even thinking about their elbow, and that makes the return to throw a lot easier. The last exercise that I want to talk about is actual throwing arm drill. So I love to use plyo balls, especially with younger athletes. This is a little bit heavier ball. It's 1,000 grams. What it's going to do is it's going to feed the mistakes. So if you have throwing form where you're using your elbow a little bit more, you're going to notice quicker with a heavier ball, and you're going to self-correct, or it's going to hurt, and you can talk through and see that better as a coach, versus if they're using a lighter ball, they may be able to get away with it more with what they're doing. So I love using a heavier ball early in the rehab process just to see how people are moving. And then, as I mentioned with the medicine ball, a lot of folks, when they start coming back from an elbow injury, will get very elbow dominant when they're throwing. You know, they're kind of pushing the elbow out there and not really rotating through. So we want to teach them to focus on rotating through here. So I love, even if it's just simple squared up throws here, coming through, teaching you to use your whole body, coming through like this, really retracting that shoulder blade. If they're having trouble with retracting the shoulder blade, I'll start them up here, focus on coming back like this, feeling that movement coming through here, and then we throw from there. Because we want to do everything we can to make the throw as least elbow dominant as possible. We want to be rotating through the pelvis. We want to be bringing the shoulder blade around. We want to be using that shoulder and lay back, and then the elbows just along for the ride, because that's how they should have been throwing in the first place. And that's definitely what we want to emphasize in the rehab process. So that covers everything that I like, from early exercise and recovery all the way through to a throwing program. Obviously, there are a million other exercises that I would do with people. This is just giving you an idea of some exercises and some rationale that I would like to use with my athletes. If you're a throwing athlete in the Sterling area, you're always welcome to stop by Eclipse Wellness, even if it's just for an assessment, if you're not dealing with injury or anything like that. Or if you are dealing with injury, we'd love to have you for physical therapy. If you have any questions or any suggestions for other videos, please comment down below. Share with someone who you think this would be beneficial for. Thanks for watching.